Hey, my name is Leah Cowart, and I'm doing this presentation for my Pathophysiology class. Today's September 1st. And then this is my note card, front and back. So, today I'm going to be talking about a syndrome that's a part of the digestive tract, and it is ascites. Ascites is a buildup of fluid in the abdomen. It usually forms between the organs and the abdominal lining. It can cause the person with it, many different issues. Some of these clinical manifestations are going to be abdominal bloating and swelling, abdominal pain. If there's enough fluid in the abdomen, it can actually, press on the lungs and cause some shortness of breath. You can have indigestion, constipation, loss of appetite, frequent urination from pressing, the fluid pressing everywhere down there, and then even back pain if the fluid is, that much. Depending on the severity of the amount of fluid that's in the abdomen, there can be different treatments for it. If it's just a little bit of fluid, doctors maybe could prescribe like diuretics, some lifestyle changes to fix it. Most people probably get antibiotics just because of the risk of infection with all the fluid in there. If it does become like so severe that it's causing more of these symptoms for patients, they can actually do a paracentesis, which is where the doctor will go in and stick a needle through the abdomen into the peritoneal cavity and actually draw off the fluid. You'd be surprised at how much fluid you can get off the abdomen. I've seen like a few liters come off somebody before, so it can be a lot that builds up in there. And then they can test the fluid for send it off for culture to see if they can figure out the cause, if it's unknown, if it's cancerous or infection in there. But that's an overview of ascites. Now I'm going to talk about some similar digestive diseases that can have some of the same symptoms, but I'm going to explain the differences on how we, rule out what's what. So the first one I'm going to talk about is irritable bowel syndrome, or IBS. So this can cause some of the same symptoms as ascites in the abdominal bloating, distension, pain. One of the main symptoms of IBS, though, is going to be diarrhea, whereas the ascites causes more sometimes constipation. IBS can cause diarrhea and constipation because it's usually has to do with their diet and what foods they're eating. If someone with IBS can figure out the triggers, then they can, kind of slow down their IBS symptoms. Whereas ascites, that fluid is going to be there until it's medically managed and drawn off, or given something to get it off. So that's the difference in that. The second one is pelvic masses. So depending on if they're in the lower abdomen or not, they can cause the big belly, abdominal distension, and usually ultrasounds or CTs, things like cysts and stuff that may be in the lower abdomen. Those two tests can figure out if it's actually fluid in the abdomen or in the pelvis. And then bowel obstruction is when something's blocking the digestive tract, so food and stool can't get through. So they still have that sharp abdominal pain, swelling, but usually a CT is the definitive test for that. It can show if there's a blockage in there or if it's just fluid, and usually you treat bowel obstructions by either, if they're smaller, NPO, NG tube to decompress, or sometimes if they're severe they will have to have surgery. And then the next thing I'm going to talk about are 3 diseases that are actually related to ascites. So one of the main causes of ascites is going to be liver cirrhosis, whether it's from alcoholism, viruses, genetics. Most patients with pretty bad liver cirrhosis are going to get ascites. And this is just when scar tissue forms where the healthy liver cells were, and causes the liver to leak fluid into the abdomen from the high pressures in the portal vein, and that's called portal hypertension. So then they get that fluid build up from that. Pancreatitis can also have ascites, from that, just from the leaky pancreatic duct, from the damaged duct. And then also many patients with cancer, there's a bunch of different types of cancer it could be, but any cancer down in that area, so like uterine, ovarian, stomach, liver cancer. If there's a tumor in there, it can press on the, if there's a tumor in the abdomen, in or around the abdomen, it can kind of compress and the peritoneum and trigger it to produce more ascitic fluid, which leads to ascites. So yes, that is my speech on ascites. Hope you learned something. Thank you.